Good afternoon, everyone, and welcome to Thundermist Virtual Baby Shower Series. Today, our very own Dr. Sarah Porta and Erica Fulton, CMN and PH Nurse Midwife, will discuss how to navigate your fourth trimester during COVID-19. The fourth trimester is the 12-week period immediately following the birth of your baby. During this time, babies are learning to adjust to life outside the womb. Not everyone's familiar during this time. This postnatal time period, but every parent and their newborn baby will experience it. In the fourth trimester, it can be especially hard to engage with families while social distancing. You may be wondering, what are some of the safe ways to engage friends and families? Thundermist prenatal care providers are here to answer your questions. In this live event, please type your questions into the comments during the live stream, and we'll do our best to answer your questions. Before we begin our Q&A, Thundermist would like to recognize Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. Thank you for making these virtual series possible. We are excited to have one of our baby shower sponsors here with us today. Neighborhood Health Plan of Rhode Island, Rosemary from NHPRI. She will explain how you can win this grand prizes. Rosemary?
Hi and welcome. My name is Rosemary O'Brien. I'm a health and wellness specialist at Neighborhood Health Plan of Rhode Island. We're excited to announce the raffle prizes for this virtual series and how you can enter to win. You can win a new crib, car seat stroller combo, or a baby monitor. This is how you enter the drawing. Watch each session live or recorded to get the link to enter our grand prize raffle. We will share the link in the comments section of each session. Viewers will have until Sunday, July 26th to enter to win, and the winners will be announced on Monday, July 27th on Facebook. As a sponsor of Thundermist, Neighborhood has a lot of helpful resources for pregnant people and children. We have a prenatal rewards program. So if pregnant women get the recommended amount of visits, they can get a $20 Visa gift card. If they go for their postpartum checkup, they can also get a $20 Visa gift card. We also have member rewards program for people of all ages from birth to 64 years old. People can, if they go for their well visits, if they get their immunizations, lead screening tests, and a variety of other things, they can get $25 Walmart gift cards. And right now we're trying to educate people that it's really important to get into the doctor's office because it's important to have immunizations and well visits. Right now people are afraid and they're not going in for those visits, but it's really important that children have those visits. So your medical providers, Thundermist, they're taking special precautions to keep you and your baby safe. So anyway, thank you so much and enjoy the program.
Thank you. So here we have Sarah, Dr. Sarah Della Porta.
Hello. Hi, I'm a family doctor at Thundermist Health Center. I work at the West Warwick site.
Excellent. And Erica?
Hi, I'm Erica Fullerton, and I'm a certified nurse midwife, and I work in Woonsocket at the Woonsocket site.
Excellent. Very excited to have you guys. So let's start. So Dr. Della Porta, let's kick off the big question with what are the best ways for families to stay safe after bringing the baby home? Can we still celebrate?
Yeah, we think about that question not only during the time of the COVID-19 pandemic, but really all the time during cold season and flu season. I think everybody is cautious about how to best welcome and celebrate a new baby in the family while keeping the baby safe. Some things that I think of always and a little bit more now are limiting the number of guests that come to your house to people that's a very small crowd, or maybe people that are essential to you. Like maybe you need the help of a family member or a friend to care for yourself in your recovery period or to care for your baby. And then if you're having visitors that you can keep a distance with because you're not relying on them to care for yourself, then keep a distance and consider maybe having your visit outside if it's not a hot day and you can be in the shade. I think celebrating is a really important part of welcoming babies during this time when we're all feeling a little bit isolated, and people want to celebrate with you. So some things that you can do to allow people that opportunity to celebrate with you that is less risky because it is less physical contact are things like allowing people to make you meals or allowing them to run errands for you, like going to the grocery store, picking up things from the pharmacy, or maybe helping with some outdoor things that need to be done at your house so they're able to contribute to your family as you grow your family, but still keeping physical distance.
I think one other thing that we can do too is that anyone with a smartphone, which are most people nowadays, you can also do Zoom calls. And then you can include all of your family and then everyone can see the baby up close and with social distancing.
It's a great idea.
That's a great idea. Thanks. Erica, how can you receive postpartum care during COVID-19? It's kind of hard to get the babies out. What do you think?
It is hard to get the babies out, but when you come to Thundermist, everyone is screened. And so no one is allowed in Thundermist without being screened and making sure that no one has symptoms. And so it's pretty safe to come here. So there's a couple different ways. You can do telehealth visits, which we've done all throughout pregnancy. So if within the first week, usually prior to COVID, we would see you 4 to 6 weeks postpartum. Now we can talk to you on the telephone. So if there are any questions that you can have, you can call and say, listen, I'd love a visit. Then you don't have to leave. Then you can just be in the comfort of your home, call, you can have an early visit, or you can bring your baby and to be seen for your postpartum visit. So there's several ways that you can still maintain care during this period.
Dr. Del Porta, how can you politely tell friends and relatives they cannot see your newborn right away due to COVID-19?
Yeah, that it feels like a sensitive topic, but I think it's a topic that we're not experiencing for the first time now. This is a thing that comes up and I counsel patients about regularly during cold and flu season, and we want to think about even more diligently during this pandemic. I think most people are very comfortable with the idea that newborn babies and the newborn period is a sensitive time, and we want to be cautious around the number of people we expose them to. But I think saying to people something simple like, I'm doing my best to keep my baby safe, and he or she is so young, we're just limiting the number of guests that we have. And it's very normal to say, if anybody is sick, please don't visit now, but visit us later during a better time. And of course, for any visitors that you do have, doing things like extra hand washing and considering mask wearing, depending on how big your social circle is a great idea.
Great. Yeah,
and one of my patients said, "Can I just blame you?" And I said, "Sure. You can just blame me and tell them that I said during this period, you need to keep the baby safe, and your practitioner said, you should wait at least however many weeks." And so she felt really good about that because it took the onus off of her, so she wasn't the bad guy.
Yeah,
that might work really well. So we don't hear a lot of people talking about the fourth trimester. So Erica, why is the fourth trimester an important time for parents and baby?
I think this is so interesting because we don't talk about the fourth trimester, and we talk about pregnancy and how we're going to get ready for pregnancy. We talk about what we eat and what vitamins to take and what prenatal classes and how to breastfeed and all of these different things. And then we say, here's your baby, go home. And then you get home, speaking from experience, and you think, oh goodness, now what? So there's so many different things going on throughout the fourth trimester, from just your body to the dynamics in your home to everybody else. And we don't really prepare, and we don't really talk about how's that going to affect your 3-year-old, or how's that going to affect your teenager? How's that going to affect your relationship with your partner? Because all of a sudden it becomes focused on this baby, which is wonderful. But I think if you start to have conversations before, then everyone eases into it a little bit better. The transition is a little bit smoother than just bringing home this baby, which we all do, and everything gets focused on this baby. So I think taking care of that, this communication, so that everyone is on board when that baby comes home. I think one of the most important things about the fourth trimester is sleep. Take away, you just pushed or had surgery or whatever, this person out of your body. You have relationships, whoever it is that you live with, your significant other, your mother, your sister, whoever, your friends. You have stress from all these different areas of your life. When you're tired, that's magnified by 1,000. Add on any one of those different things, the relationships to new babies, to healing, And 3 o'clock in the morning, coping with this newborn screaming is much, much more difficult. So for me, I think that sleeping is one of the key things, and asking for what you need. So, it sounds cliche, sleep when the baby sleeps, but I feel that this is such an important part of the fourth trimester, because then you're able to cope with everything else that is thrown your way. So sleep and communication and asking for what you need during the fourth trimester is vital, I think, to the success of being happy and coping with this new baby.
I love that you just named some of those things out loud, Erica, because I think so many people feel stressed and feel overwhelmed, but can't necessarily say, what is this thing that's making me feel not
Right.
myself? Well, I'm less connected to my people than usual because I'm caring for this baby, and I'm not sleeping, and I'm hurting. So I love that naming those things out loud can really help people identify, oh, this is what's bothering me.
Right.
One thing that I've seen patients and peers really benefit from is peer support. And there are a lot of online and virtual support groups for new moms or moms of multiples or whatever your unique situation is, where you can hear people say what they're feeling and identify, that's what's going on for me. And it can be really helpful just to say out loud, like, I feel that too, and here's how I'm coping with it.
Right. Yeah, I think it's huge. I never really thought about the fourth trimester until this. And then I was like, oh my gosh, this is huge. Yeah, just even that support. You're right, just of saying it. And
the fourth trimester, I think, sometimes gets oversimplified into this concept of baby wearing and skin to skin. And that's not all that it is. It's a lot more than just that.
Yeah, absolutely.
Great. Thank you. So, Dr. Della Porta, how do you choose a provider for your new baby, and when should it be my first visit with the baby?
It's a great question. I think a lot of ways people make this decision is word of mouth and asking, who your friends' children see. There are a lot of providers that take care of newborns and children, and that can be anywhere from if you were seeing a family doctor in your pregnancy, or you see a family doctor for your primary care, that person can see your baby. Your family nurse practitioner can see your baby. Some, but not all, midwives will see babies for a period of time. And there's pediatricians available as well. So finding the person that is the right match for you is a little bit harder and can take asking around to your friends. Sometimes people will even do like a meet the provider visit before their baby is born to see, does this person's personality and philosophy kind of match with mine? And that's something that most people offer. I think something that I have seen people learn over a period of time is your pediatrician or your baby's doctor is a piece of the puzzle, and it feels like a huge decision when you're first making that decision, but they're not the only one. We are not the only one in charge of your baby's care. You know your baby and you know what your baby needs. So it's an important decision, but it's just a piece of their care.
Great. And so I know we talked a little bit about this, but can you again explain a little bit more? Why is it so important that parents and their babies and their children be seen during the pandemic?
So in those earliest visits, we're looking at a lot of really important things, some of which are measurable, like we want to see that your baby is growing their weight and their head is growing and their length is growing. And that relates a lot to feeding. So there are a lot of, it seems simple, feed your baby, but it's not simple at all, which is why we talk about it so much. So however you're feeding your baby, there are a lot of nuances and a lot of things that maybe babies decide isn't the way they want to do it. And so at those visits, we can help troubleshoot that and make sure the baby is getting the proper nutrition and growing with that nutrition they're getting. There are also a lot of questions that maybe feel not big enough to call about. We're always happy to receive those questions by phone call, but sometimes it's easier to express them face to face. So having those well visits also gives people the opportunity to ask about simple questions like dry skin and diaper rash and baby hiccups and baby sneezes and all of those things that we see all the time. But when you're the one at home with the newborn, sometimes they can seem scary or weird. So those visits give us a time to reassure about those things. And then we also talk about development. So how to stimulate your baby in a way that baby's brain is developing and body is getting strength and coordination. And we examine your baby to look at his or her development. And then, of course, over time, we want to repeat exams of the baby just because different things show up at different times. So we see babies very often in the first year, and even during the time of the COVID-19 pandemic, we want to keep up with that.
And one other thing, there are so many different things going on right now besides COVID-19. And so it's important to remember that COVID-19 is not the only thing. And so it's important to keep going just so that you can keep on top of, all the other sicknesses out there that can happen.
Great. And Erica, can you talk a little bit about when you should start talking about family planning following the baby's birth?
So basically, you can talk about it at any time. I always visit it around 28 weeks when we're heading into the third trimester to see what people's plans are. Some people don't want any more babies, so it's good to talk about what steps that you should take if you want to have permanent sterilization, or if you don't want any babies for 5 years or something. And we talk about all the different options. A lot of those options can happen in the hospital. And so when we talk about it at 28 weeks, if you want an IUD after your baby's born, that can happen in the hospital, or an Explanon, in your arm, the rod in your arm, you can have that. So around the beginning of the third trimester, we start talking about it so that you can sort of, are you going to breastfeed or are you not going to breastfeed? Because some certain medications, birth controls are not appropriate for breastfeeding. So then when you're in the hospital, they'll usually ask you, have you thought about birth control? Do you know what you would like? And then again, at your postpartum visit, we also revisit it there. So there's many different times that we talk about it, but the first being the third trimester, so that we can get on board as to where you feel like you are and what you want.
Great, thank you. And Dr. Della Porta, what should you do if someone close to you tests positive for COVID-19?
Great question. I think the first thing to do is not panic. It's really easy to get really worked up about that. And we just remind ourselves in that moment, like, I'm safe. I have people around me that know how to help me with this. And so take a deep breath is the first thing to do. And the second thing to do is call your doctor. So depending on your personal health and what symptoms you're having, it may mean get tested. It may not mean get tested. If you had a prolonged exposure and you were close to that person, physically close, it likely means quarantine, which means 14 days of staying home to monitor for any symptoms. So I think, again, first thing is don't panic. And then second thing is call your doctor. It's a very valid reason to call and ask this question, so we can really personalize the decision about testing and quarantine to your specific circumstance.
Great, thank you. Well, let's take a look here. I think we have some questions from our viewers. So let's see. All right. So this is a great question. So is a non-busy restaurant okay for newborn, whether dine-in or out? Is that safe? What are your thoughts?
I think dine out means take home, and I would say absolutely yes for take home. I think there's not an absolutely right or wrong answer here, although I certainly words stay home. I think people ask often about when can I fly with my newborn? When can I go to the mall with my newborn? When can I go to a restaurant with my newborn? And I think those first 3 months, there's a different right answer for every family, depending on what amount of risk you're willing to take and how pressing the need is to go to the place that we're talking about. But I think unless there's a pressing need, I tend to err on the side of minimizing a newborn's exposure to big public places, especially in that first 3 months of life. And the primary reason for that is fevers in newborns, so in babies under 3 months old, are a big deal. And it can be a fever from a common cold that a baby is going to recover from just fine. But we don't know that. And we kind of take the fever as serious as possible until we prove that it's something that's totally safe. So I recommend minimizing your baby's exposure to the public under 3 months of age as much as you can.
And you can't control other people, and people love to touch babies. And so that's a hard one when you're out anywhere. I mean, I've seen the signs now that people have on the strollers. I forget what they say, but essentially, don't touch my baby. But some people just do it. And so to minimize that, stay home.
So you talked a little bit about fever. Can you tell us what's considered a fever?
The temperature that we consider a fever in a newborn is 100.4. And I say this over and over again every single day, not 104, but 100.4. And we really want to measure that rectally with a rectal thermometer in babies that are under 3 months of age, just so we know that it's super accurate and we don't over or under react to something.
Great. And so is there any way that you can cover your baby or protect your baby when you have no other choice than to head out of the house? I know adults in 2 years and over pretty much wear a mask, but you can't do that with a baby. What is your recommendation as far as there any way that you can protect your baby?
So there's not a scientific study about these covers that go over car seats. They do exist. I think the safety of them is also not very well studied. I think if you must go out and you want to use a cover over a car seat, you want to make sure it's well ventilated so your baby's not getting too hot and that you're with your baby the whole time, so that you don't want to leave baby unattended in the car seat with a cover on it and not realize it's too hot or baby's position has changed or that kind of thing. And the alternative, I think, would be if you must go out, wearing your baby in one of these baby carriers, so baby's facing your chest and not being touched or touching multiple surfaces is probably a safer way to go out if you must.
Great, thank you. So let's take a look here. We have another question. Do kids get sent to Hasbro for a routine checkup if the child or guardian can't enter Thundermist due to cold symptoms?
We would not send a child to Hasbro for a routine checkup. I think if the parent had a symptom and the baby needed to be seen, we would probably work that unique circumstance and just personalize the situation. So whether it means coming out and doing the baby's checkup outside or doing the checkup in a different part of the building that's more isolated from the regular part of the building, we can definitely accommodate that kind of thing. It just needs to be cautiously creative in the moment, but we would never send you to the emergency room for a checkup just because of a parent's illness.
Sounds like Thundermist is doing a great job with being flexible and trying to figure out different ways. So
I think so.
And if you call, you can get those different options of how to get treated.
That is great. Thank you. Let's see. So how long does postpartum recovery typically last?
Well, are we talking the fourth trimester? I guess that depends. Physically, everyone is different as far as recovery. Recovery is different and the type of delivery that you had. But the fourth trimester that we're talking about is typically 12 weeks. But everyone is different as far as how they heal and how much activity they're doing and sleeping and nutrition and on all of that. So I don't think there's a straight answer for how long it was. Generally, we see people at 4 to 6 weeks and people are pretty healed by then.
Great.
But some people are longer and some people heal quicker.
Great. So it sounds like these visits are crucial to kind of have that discussion with your provider on what exactly you're trying to
do. Yes.
Right. Excellent.
And I think especially to make sure that something that you may think is normal for you is indeed normal. So if you're thinking it's normal to be feeling such and such thing 3 months after delivery, we might say to you, you should be healed by now. Let us help with that.
Right. Which is why it's important to keep your appointments.
Great. Thank you. Let's see. How do I get the baby to eat less? I've been told 3.5 ounces of breast milk is too much for a 2.5-week-old baby.
Good question. So I think it's a question that I would probably have a lot of follow-up questions to, but some things that I think of with this question are sometimes babies seem hungry when they actually want to soothe by sucking. So some people use a pacifier, not everybody does. And then the other thing is, if you're talking about breast milk, so some people are pumping and feeding or some people are directly feeding. It's pretty infrequent for a baby to overfeed if they're directly feeding from the breast. If they're bottle feeding breast milk, then 3.5 ounces is a little bit on the high side for a baby that's 2.5 weeks old. But every baby is different. So some babies, if they're taking 3.5 ounces and not spitting up and growing normally, then that may be normal for your baby. If we see that your baby's spitting up a lot or growing abnormally, then that's something to pay attention to. So those are some ideas with that bit of information, but I would say that's a very appropriate question to ask your baby's doctor, just so they can ask you some more details as well.
Great. Let's see. So what can you do to protect your baby if your oldest visits other parents every other weekend? So we see that a lot. It's a good question.
That is a good question. The basic, distance, it's hard when you're in the same household, but if you don't know the context that the other person has, then just keeping the baby 6 feet away, washing all your surfaces, washing your hand, the doorknobs. Maybe your oldest doesn't hold the baby during the newborn period until you know what the contacts are. The same, being outside. I mean, all these things are pretty tricky when you're in the same household, but just doing your best. That's all we can do, is to do our best. If they have any symptoms at all, do not have them near the baby.
I like that you emphasize doing your best, because I think it's really easy for us to get caught up on these very rigid guidelines, and we really have to personalize them for what makes your life kind of okay. So this looks like a circumstance. It's nothing you can change. The older child is seeing their other parent every other weekend. You're going to live together. And so I think having a conversation with the other parent and saying, let's kind of consider our circle the same people, and really limit yours and mine so that it's small on both ends. So we're not bringing something to you and you're not bringing something to us. I think that doing your best in that situation is the right thing.
Right, because you also don't want your oldest to feel bad.
Yeah.
That's a big part of it too.
Yeah. It's a lot of changes.
Yeah.
Let's take a look here. All right. So I think that concludes our viewer questions for now. Let's see. Excellent. Yeah, looks like that's it for now. So that was great. So thank you, everyone. We really hope that you enjoyed getting to know our providers and sponsors, and that we were able to answer your questions. Before you leave today, please be sure to enter to win your grand raffle prizes. Participants can look in the comments for a link to enter or win visit, and there's a link right there. So make sure you copy that. Very important. You win some really great prizes, as explained earlier. And today's session will be recorded and available to view in the future. So if you want to check it out again and also refer others, that would be fantastic. Thank you so much to Neighborhood Health Plan Rhode Island, United Healthcare Community Plan of Rhode Island, Puff Plan, Landmark Medical Center, for generously sponsoring the virtual series. If you need prenatal or primary care, Thundermist offers services for all ages, and they do not turn anyone away. So if you can't pay, you're still welcome. Everyone is welcome in our home. Please call 401-767-4100 to schedule an appointment today. Thank you, everyone.
Thank you.
Bye.
Bye.